Greetings, my friends. It is 8 months and 3 weeks post-op. For those of you new to watching my channel, thank you for joining us. In March of 2020, I had a rare and controversial surgery called pudendal nerve decompression surgery. After years of pelvic nerve pain, pudendal neuralgia, I decided to make the jump to have the surgery to decompress the pudendal nerve, which is the main nerve in the pelvis that's responsible for the pelvic floor. The pudendal nerve is pretty much followed it through its course in the pelvis, and it's decompressed all the way down, clearing out scar tissue from the nerve. It's a very controversial and major surgery for this condition. Many people say that it takes up to 2 years for them to regain their lives after having the surgery. Nerves take a very, very long time to heal out of any body tissue. The body prioritizes healing in different ways, and the nerves are very low on the totem pole of healing. Primarily would be blood vessels and organs, and then ligaments and nerves. So that's pretty much how it goes. I am 8 months and 3 weeks post-op. I have not noticed any sort of quality of life improvement after the surgery. My pain has definitely changed its presentation due to a variety of factors. However, I am pretty much severely disabled. Well, not severely disabled. I guess I'm moderate to mildly disabled compared to most people, but my life has drastically been altered from what it was. I started having pelvic issues in 2013, and then it just kept gradually getting worse until 2019. I basically became bedridden, and thankfully I am able to work a remote job, so that helps. And so then in October of 2013, I had a venogram with intravascular ultrasound and discovered that I had 3 major vascular compressions, one being the kidney vein, otherwise known as Nutcracker syndrome, the other being May-Turner syndrome, which is basically the iliac vein in the groin area, as well as pelvic congestion. For those of you who aren't familiar with those things, it's basically the vein is being compressed and blood flow is either being rerouted or restricted or pooling in areas that it shouldn't be as a result of these compressions. I had a stent placed on October 30th in the left iliac vein, and it's about 1 month post-stent for me. And my doctors, basically I had a follow-up with interventional radiology on December 1st, and they were basically telling me that I was one of the most extreme and distinct versions of May-Turner syndrome that they've ever seen at the facility, which is I am kind of jaded because I usually spend my days talking to people who have worse compressions than myself. So it's kind of hard to believe that I'm the worst person they've seen. However, that's what he said. He said that the stent that they placed fit perfectly in the vein. Normally, I mean, I'm not an expert at this, but stent placement, it depends on vein size, patient size, how dilated the veins are at the time, etc. So, and I'm basically going to be on blood thinners for the next 3 months, and then after that, I'll probably just be taking aspirin daily or whatever that they deem it necessary. They want to do an ultrasound to check on the placement of the stent, make sure it's open properly and stuff like that. I am still really struggling with nerve pain, but the thing that ties kind of all of this stuff together is the discovery that I most definitely have some type of Ehlers-Danlos syndrome, and it explains that the reason that my nerves and blood vessels became so compressed, restricted, etc. People with Ehlers-Danlos syndrome have is a genetic condition in which the proteins that code for collagen, different types of collagen throughout your body, supporting your organs, blood vessels, joints, ligaments, etc., etc., many people with Ehlers-Danlos syndrome have a very wide variety of insidious issues, most of them which people cannot connect the dots very readily. And the average age to get diagnosed with Ehlers-Danlos is in your 40s. So I pretty much figured out I had Ehlers-Danlos syndrome after the vein compression issues. I was just reading about the correlation between vascular compressions and Ehlers-Danlos syndrome. And then I began seeing a physical therapist who she herself has a form of Ehlers-Danlos, and she decided to, she was doing she was helping me at the physical therapy facility, and she saw me and was pretty much like, yep, I think that you have Ehlers-Danlos syndrome. And that pretty much got me researching. I came across some people with Ehlers-Danlos syndrome back in like 2015-ish, but I kind of just put it out of my head because the stereotype with people with Ehlers-Danlos syndrome is that they're super flexible and they're doing splits and all these really weird movements with their body, which may or may not be true. Everybody has different presentation of Ehlers-Danlos syndrome. Even people with the same exact types of Ehlers-Danlos syndrome present with a really wide variety of, in a wide variety of ways. And a lot of the symptoms overlap between the types, so it's very hard to tell. I had an appointment with a genetic counselor on Friday via video, and they're ordering the tests to test for certain types of EDS as well as other connective tissue disorders. So whether or not I turn up positive on this genetic test, I know I have Ehlers-Danlos syndrome because the most common form of it currently does not have a genetic marker that they are aware of that codes for it. So it's very possible that I have the hypermobile type of EDS, which is the most common type to cause a really bad variety of pain issues, which is what I'm exhibiting. And so it's important for me to get this diagnosis on paper so that when I go to see other specialists or when I'm trying to fight for disability, I can have something to put a name to the face. And I've been doing, the EDS Society has support groups via Zoom, which have been extremely helpful, and just listening to what other people are dealing with. People with EDS have a really, like I said, wide variety of issues. Dental issues, bladder issues, digestive issues, joint issues, ligament issues, pain issues, cardiac issues. So there's so many things that tie all of this stuff together that I overlooked even when I was a child, that I was experiencing, like just joint pain and things like that I was dealing with, because the nerve issues were so in my face that I just kind of ignored all the other stuff that I was feeling and experiencing. And I think now it's just coming full circle. And I've had a lot of moments going, oh, like, so, really, I'm just looking forward to doing this genetic testing and just ruling out some of these severe types, because it has been brought to my attention that I may have vascular Ehlers-Danlos, but again, until I have the test, I don't know, because a lot of the symptoms overlap, and many people, even of the same type, don't all have the same symptoms. So that's my next endeavor. When it comes to the pudendal nerve decompression surgery, for anybody who has pudendal neuralgia or struggling with pelvic pain, I would really encourage you to stay away from this type of surgery unless you have done anything and everything you can to rule out other types of disorders, including Ehlers-Danlos syndrome, including gastro disorders, including cardiac disorders, including every other system of the body disorders, and unless you have done everything possible, like injections, physical therapy, even nerve ablation, I would recommend over having the surgery, because it's a very long and grueling 2 years, and I don't ever know if I will ever have the life I used to have back. I probably won't, but in terms of the nerve pain, I really don't think I'll ever be pain-free. It's always going to be a struggle, and I'll always wonder if I made myself worse by doing the surgery, because people with Ehlers-Danlos syndrome have issues with healing, and we have tissue fragility and hyperextensibility, and taking longer to heal, and abnormal bruising and scarring and things like that. So it hasn't been studied, the effects of having certain things done to people with Ehlers-Danlos syndrome. So I would really encourage people to looking at the surgery to rethink your decision. I mean, I was extremely lucky that I had Dr. Michael Hibner. He's one of the best surgeons for pudendal nerve decompression in the country, and I'm thankful. He's an amazingly compassionate doctor. He just opened his own practice in Scottsdale, Arizona, and I was super lucky to meet him. He's such a brilliant man, and I respect him a lot. However, for my particular case, it just wasn't the route to go, and there's no going back. I may or may not have ruined my body forever, and I don't regret having the surgery per se, because I do feel like just knowing that my nerve was so damaged and entrapped did really put my mind at ease, just knowing that I'm not crazy, and it led me to other things. So I don't regret it per se, but I just definitely think that it's a surgery that should be highly, highly, highly researched and considered, all other aspects considered before going through with it. That's pretty much it for now. I'm looking at doing a new pain management program at a doctor's that are kind of more familiar with Ehlers-Danlos and treating people with EDS. So that's kind of the road that I'm going down. I will talk to you guys in another week, and thank you for watching.